Hey everybody, I just want to let you know I just started recording. I missed the last 4 or 5 meetings, but it's good because there wasn't any agenda items. Uh, but I just started the recording. Any other thoughts?
I think I'm more comfortable with this, the WebEx versus meeting in a park and wearing a mask. Um, if we're not going to meet in a meeting in a room all together, to me this is just as effective than just sitting in a park where I'm going to get distracted watching squirrels and airplanes and everything else.
Unfortunately, our conference room, unless we find a different location, which we could, but our conference room is kind of tiny for a total of 14 board members plus Liz, Robin, and I. Plus, keep in mind we have to open it. Actually, we don't have to if we offer public WebEx, but we might have to open it to some public members as well. So, for 16 people, our conference room is way too small for social distancing.
Mircha, as much as I would like to get everybody back in the same room, believe it or not, I miss this crazy bunch. But I kind of agree with Dean as far as I think outside it sounds nice, but I think it would be hard to stay focused on business. And I don't know how everybody else is, but for me personally, everybody wearing a mask and spread out, it's hard for me to hear, to see what's going on with all the distraction. If we could find a larger venue that we could assemble and still maintain the proper social distancing, I think that would be wonderful. But if not, I do think that the video chats are. I think this works. Might not be our first choice, but I do think it works. So if we have to for now, that's fine too.
Okay. Any other comments? Okay. Well, um, I think we're gonna do August through WebEx. It's maybe the conclusion. I also again hate, and I agree with Luke. I would hate for us to spend time now trying to find a venue and maybe rent it or whatever. And again, you might not have. You probably still have more people attending through WebEx than maybe a in-person meeting at this time. Okay, we will start our regular business. I emailed everybody, I believe Friday, the agenda, and the agenda had a total of 3 pages, which we will put on our website by the end of this week for the public to see. Again, the meeting is recorded, and I hope is recorded right. If not, I'll have to go back and type minutes. First item on agenda is the calendar year 2020 supplement to annual appropriations. Fund account A132, which is a federal fund account covering alcohol and drug addiction treatment and prevention services. At the June board meeting, we didn't appropriate enough funds. So again, the funds are there, the revenues are going to that account. We just didn't appropriate enough so we can encumber it for the contracts that were already approved by the board. So it's just a fiscal formality. Contracts were already approved, funding is available, revenues already committed and coming in. We just didn't do the resolution. Actually, we did a resolution, but we missed this particular fund account. Initially, we thought we have enough, but we realized we don't. So we are actually $130,072.96 short to appropriate for the amount we actually approving in the contracts. We can actually appropriate up to $190,000, but we need $130,072.96. Again, this is fund account A132, alcohol and drug addiction treatment and prevention services, federal allocations. Again, usually we just miss this. We thought we have enough initially, but this is usually part of the large June sub app resolution that everybody goes around and signs, but we pass resolutions to be able to use electronic signatures from all of you guys. just a simple fiscal formality. Any questions? So we will propose this, unless you guys have any question, we'll propose this to the board meeting to be approved. Before I even go further, I realize I should have introduced Charity. I know I introduced her in letters and emails to you guys, but you guys are able to see Charity actually there. So Charity is our newest board member, actually should be official on August 27. She already, because of the way we have meetings right now, she and Tanya already planned and she took her oath of office and signed it. We'll probably do another formality during the August board meeting, but I wanted to make sure we have the signature and the stamp and everything. So she was appointed by the Ohio Department of Mental Health and Addiction Services. She is a Wyandotte County resident, lives in Sycamore. And Charity, if you want to unmute yourself, you can say a few things about anything you want. You are on.
Okay. My tutor left. My granddaughter. I have a family member that has mental illness, and I'm been on the NAMI board, and I'm looking forward to helping, promoting, and educating people. And I will do whatever it needs to accomplish that.
Thank you, Charity. Welcome on our team. Please, again, some of these things, maybe again for some of the members, they've been around a while. It's very regular business. If you are confused about anything, please stop us. I'm going to go to number 2 on the agenda. January of 2019, we approve a contract with University of Toledo Medical Center for children inpatient psychiatric services. This was for children inpatient. We, as a region, 23 counties in a region, we also had the regional contract with the same agency for the same services. But then almost all the other individual boards also chose to enter into a contract with this agency directly in case the regional pool of funding will be exhausted. Okay. At that time, our board, again in January of 2019, approved a total of $45,441 out of levy reserve funds to enter into a contract with UTMC. In our contract was clearly specified that our funds are not to be used until the entire regional pool of funds are expended in full. So this was again levy reserves contract. The breakdown was $15,441 from Seneca levy, $15,000 from Sandusky, and $15,000 from Wyandotte. The contract terminated, and we haven't expended the contract. We didn't have to spend a dime because we still had money in the regional contract. Regional contract again was 23 counties in Northwest Ohio. The 23 counties in Northwest Ohio are going to continue a regional contract with UTMC, but now we are projecting that these funds will probably be exhausted by the end of the year. Therefore, I'm recommending for us to enter into a new contract with UTMC, utilize all funds that you guys already approved out of levy reserves. No new money, no fiscal year money, the same funds that you guys initially approved and weren't expended. For a fiscal 2021 contract, this contract gonna go back retroactive July 1 of this year and will go through June 30th of 2021 and will most likely be utilized and tapped into probably from December or January on. Until then, we believe we have enough regional funds to cover these services. Again, these are for children from Seneca, Sandusky, and Wyandotte, inpatient psychiatric unit at UTMC. Robin, if you want to say a few words, more details about services that are taking place, please go ahead.
Sure. Basically, this contract covers two issues. The first one being for our children or adolescents who don't have insurance or who are underinsured. And that's really why this contract came to be is we not so often do we have kids who have no insurance. It's really that they're underinsured. And we're talking more about the multi-system kids. So insurance on average will pay for 5 to 7 days inpatient. And a lot of times these kids have some complex issues and they need longer stays than what their insurance would pay. So this contract steps in to pay for those additional days that it's going to take to get them stabilized and for some cases to stop the revolving door where they've been coming in and out under the traditional 5 to 7 day stay. The other piece that it covers is the inpatient doctors like to have neuropsychiatric testing for the kids. And again, sometimes insurance covers that, sometimes it doesn't. But because kids are going through so many developmental changes and issues, the docs like to have this testing done to get a better picture of what's going on with them developmentally. And this contract will cover those fees.
Is this the judge join us?
Yes, it's D.
All right, Dee, thank you.
Sorry.
I do want to mention that this is the only contract we have with an agency for inpatient psychiatric services for adolescents or children. We have agreed on all the contract terms. We actually have a copy just ready for you guys' approval. Any questions? Okay, this will, if there are no further questions, this will also be a recommended motion during the board meeting. Robin, will you cover the third item on the agenda?
Sure. The next item is regarding a fiscal year 2021 contract with Smith and Lear Company out of Sandusky. The board is responsible, according to the Ohio Revised Code, to play a role in the involuntary commitments of residents from our board district. So when a person has been involuntarily committed to an inpatient unit, psychiatric unit. This is also called the pink slip. She or he is a resident of one of our counties, then we as a board may be asked to provide legal representation on behalf of the board to address the hospitalization of that person. In this role, we are being represented on the reasons why we believe the person needs to be subject to hospitalization. We are not having representation for the client as they are afforded a legal representative of their own during the process. We currently contract with Carla B. Davis for cases at NOPH, the state hospital in our region, and we previously contracted with Vicky Roofing for cases at Firelands Regional Medical Center, their psychiatric unit in Sandusky. Ms. Roofing did notify our office that she did not wish to renew her contract for fiscal year 21, and she recommended that we consider Smith and Lear for our legal representation. Mircha reached out to the office to discuss a potential contract, and he's now recommending that the board approve a contract with this law firm. The terms of the contract would be very similar to the one we had with Ms. Roofing, with the exception of the hourly rate increasing from $125 to $150 per hour, and they also charge a $25 per hour fee for office staff as they do tasks related to the contract. The total amount is not to exceed $3,000, which was the amount that we could not receive under Ms. Roofing, and the effective dates would be July 1st of this year to June 30th, 2021. This will require a motion for approval of the contract during our meeting next week.
Any questions? Robin, would you please explain just one more time exactly what this law firm gonna do for the board?
So if a person is evaluated, let's say from Firelands, and it's determined that they need to be hospitalized and the person does not want to go willingly on their own, then by law, Firelands as a public health officer can say that individual is subject to involuntary hospitalization, and they will send them to a psychiatric inpatient unit. Part of what is entitled to that person is a legal court hearing to go through the process and continue to prove that they are subject to hospitalization. And so in this, our representation is the attorney who takes the clinical documentation from either Firelands or the inpatient unit to say this person needs to be hospitalized and here's why. So they're really representing us under our duties under the Ohio Revised Code. And then, like I was saying, then the individual, they can either hire their own attorney or they're given representation to plead their case as to why they may not believe they need to be hospitalized against their will. And so this legal representation does all the required paperwork and represents us at the court hearings. So we do not attend those hearings.
Would you, just more for educational purposes, would you estimate approximately how many of these hearings we have per year for clients in our 3 counties?
Well, it would be any time someone's up at the state hospital or at One South, and we don't always get the notifications. I'm going to guess that it's somewhere in between 10 to 15 times at those 2 hospitals. Now, we may have an individual from our county that presents in Franklin County and is hospitalized there, but we may not be asked to provide legal representation. A lot of times the hospitals will provide that themselves. And we're never asked to be involved at all.
Okay. Thank you, Robin. Any questions?
Mayor Chip, do you think the contract amount being the same will cover expenses since the hourly fee and the admin cost is higher with this group?
In the past 4 or 5 years, both attorneys that we had for these services had underspent their contract.
Okay.
They spent approximately between 60 and 70% of what was allocated. So at this time, we believe that the 3,000 still might be the right amount. If for whatever reason we realize throughout the year that we have more clients than what we expected and the cost is going to be higher, we will then have to I'll have to bring it back to you guys for additional funds. Okay, number 4 on our agenda is the calendar year 2019 Ohio Auditor of State Fiscal Audit. And I'm pretty sure all of you guys received an email approximately 10 days ago from the Ohio Auditor of State with a report. Was filed, has not been approved. The last step has not been completed yet. I believe they even asked in the email not to share the document yet, but we project they will approve the final document and release the audit in the next 30 days. Therefore, we will ask for a motion for you guys to approve that audit. Once that audit is approved by the Auditor of State, we're going to take the official copies, and usually what we do with them, we send them to the county auditors in our 3 counties, we send it to the county commissioners in our 3 counties, and then we'll also send it to the Ohio Department of Mental Health and Addiction Services. Then we'll also place it and put it on our website so it's available to the public. I believe there were 3 comments in the management letter, but there has not been any findings. So again, we scored a clean audit. I'll be honest, I was a little nervous. We had quite a bit of transition here with finances internally in the office, and I was a little nervous that we might miss a few things. But I was very glad to see. So thank you to Robin and Tanya for this. We have completed another year with no findings. I think this is the 8th year in a row since I've been around, so that's good. And also at the same time, we had a in-depth fiscal audit by the Ohio Department of Mental Health and Addiction Services, and that is not yet completed, and I'm not sure when it will be. They cover 10 main sections, and it's my understanding that 9 out of 10 has been in compliance at 100%. I believe that there's one where we have some, differences of opinion about some things, but that has not yet been finalized. So I really don't have anything that I can show you at this time. But for now, I will recommend the motion. And again, by the board meeting date and time, this might already be out and approved. But if not, after the board meeting, once it's approved, I mentioned what I will do with the audit, and I will need that motion to be able to release it. Any questions? All right, that's again just the fiscal formality. Okay, I'm gonna move to number 5 on the agenda, and that has more to do, actually kind of 5, 6, and 7 kind of go hand in hand on the agenda. And I'll probably ask you if you could go on a second page, first attachment, second page of the agenda. And there I listed, without trying to overwhelm you guys, but I listed a summary of all the state allocations or grants that we received last year and are receiving this year. This doesn't include all the funding sources that we have coming to our board. This doesn't include levy, or this doesn't include federal grants that we receive outside of the Ohio Department of Mental Health and Addiction Services. The 2 items in red that I highlighted in red, I want you to know that they have been eliminated. So I know we talk in the past about, oh my God, what is the loss, how COVID is impacting us, what kind of funding are we losing. It is pretty clear at this time that those 2 fund line items, the one for 156,977 and then 43,466 have been eliminated. And in the past, back on the agenda, we have used those 2 different pots of money to fund services for Farlands, Oriana House, Sandusky County, Adult Probation Services. There was the project that I believe you guys had a presentation a year ago at our office with APS and Sandusky County EMS. We also utilize a portion of the funds for Wyandotte County Mentoring Program through Wyandotte County FCFC. And we utilize a portion of the funds for Children's Key Point, which is a 3-county project with children's services in all 3 counties to work with children and families in foster care or adoption. So those have been eliminated. I will mention that the Children's Keeper contract, though, however, it's a calendar year contract, so they will impact only next calendar year. But Farlands, Oriana House, Sandusky, APS, and Wyandotte FCFC are directly impacted now. And I can give you those amounts if you want to know. And then in blue on the same second page, I highlighted a new line item that we received in the amount of $92,152 called Crisis Infrastructure Funds. And I will pass this to Robin to summarize you guys a little bit that and what that's supposed to be doing, or how those funds are supposed to be invested in the local communities. But one thing that I want to make it clear, you can't replace the new line item. You can't replace the old funds that we lost with the new funds we are getting, because the new funds that we are getting have different requirements, I should say, that is not matching the projects we initially approved. To make another comment, I do think that probably at the next admin committee meeting, I will probably show you guys more about our levy reserves, a report about our reserves, and I believe at that time I'll probably ask you guys to fund those 5 projects out of levy reserves. But obviously, I want you guys to see where we are with levy reserves to make sure we do have the resources, and we gotta look at our levy reserves policy. And if we have the resources, I'll probably make the recommendation to fund those projects that lost funding. Before I turn it to Robin regarding crisis infrastructure, do you guys have any questions?
Mircha, is that mandated? The through Ohio Moss? No.
I'm trying to. Can you please clarify the question?
Well, I just, that's the first I've seen. Again, the crisis infrastructure funds. Is that had another name maybe all along, or is it like a new mandate?
This is a new, totally new line item and funding source that we didn't receive previously.
Okay. Thanks.
Robin, would you talk about crisis infrastructure and how we shall, as boards, utilize these funds?
Sure. So OMAS says these funds can be used to expand access to crisis services and supports that are culturally responsive and implement and expand mobile crisis and implement core elements of crisis stabilization units. So we're trying to understand what that means. And Mircha's put a couple questions into OMAS to get some clarification. But because our board contracts with Firelands for crisis services, as does the Erie, Ottawa, and Huron County boards, we've been meeting virtually with Firelands and the other 2 boards to talk about how we could utilize the funds. We're currently talking with Firelands on how they could expand their crisis services by using telehealth services and providing crisis to persons while in their home. As situations allow for them to do that. We've also talked a little bit about expanding hotline services. Currently, Firelands is assessing what equipment they would need for their staff to be able to provide the telehealth services in the home. So we can maybe look at that option a little bit further. But these funds will allow us to continue to address our strategic plan and our community plan as they address our crisis service system. We don't need any board action at this time on this issue. It's more just to alert you to the new funds and where we're at currently on discussions of how to utilize them.
It is, as I mentioned, number 5 and 6 on our agenda. Will probably be rediscussed at the September administrative committee meeting, and we'll probably make some recommendations on 1, how to use the crisis infrastructure funds, and 2, what we can do about the other approximately $200,000 in loss of funding. Any questions? And this goes a little bit hand in hand with number 7 on agenda. Everybody should know every year, twice a year, we are required by the State Department to submit a budget for the upcoming year. So we had to do a fiscal year 2021. It's called fiscal 040 budget. This document is really, we complete a document, all the funding sources that are coming to the board, including levy, and what kind of services we are planning to utilize the funds for. So in this report, we break down the funding by how much will be individual counseling, how much will be group counseling, how much will be assessment, how much will be hotline, how much will be crisis, how much will be MAT, you name it. So we probably have close to 60 different kind of services. So this 040 budget we are projecting. Is no way anybody can know accurate how much money we're going to pay for assessments, for example, okay? Now, the report was due July, the budget was due July 31st. Obviously, we didn't meet in July, so I couldn't have you guys approve it, but I didn't want to miss the deadline, so we did submit it. So this motion will be more a formality. But if you go on the last page of the attachment, the third page that I send you with the agenda, really what we did, the last red column is what we broke it down by all the services and all the funding sources. So this also gives me opportunity to show you guys where the board was since 2013. And I like to start in 2013 for two main reasons. One, that's the first year that our board stopped paying Medicaid for Medicaid clients and Medicaid services, okay? We used to, we don't anymore. And also that's kind of the first year I started with the finances. So I have a better understanding what happened from that point on. But you can see from 2013 until 2020, and these are fiscal years, how we had a steady and healthy increase in our funding, again, for various reasons. Some probably directly to some of the actions by us as board staff, and some were probably indirected related, such as, state was doing better in collecting taxes and revenues and all that. So I do think that they increased some the allocations, but reality is mostly had to do with the Sandusky County levy and various federal grants. The federal grants really made the biggest difference. Now in fiscal year 2021, you can see in the last 7-8 years, this is the first year we are projecting a loss. We kind of expecting that. I actually don't think that the loss gonna be as we projecting. I think we recoup more of the money to going for some other federal grants. So I think when I give you this actual report, which won't be only a year from now, I'll be able to show you that we'll bring more in fiscal year 2021 than 5,288,000. I project that we will bring more than that. It's just that based on what I have today, that's all I can show you guys. Any questions? Anybody can see the last document? Okay. Going back to number 7 on the agenda, and again here I will ask for a motion to approve the fiscal year overall budget. If you actually want to see all the services and the breakdown, we can just email the document to you if you wish to, but it's probably a total of 12 to 15 different tabs and extremely long Excel documents that sometimes are hard to review. So we can email that to you. It makes it almost impossible for us to print it because it's such a large document and you need, it would be very hard to see. But if you want to see the document, please let us know now or contact us after the meeting and we can email the document to you. Any questions? All right. Credit card report. Just a summary because of Charity is new board member. Charity, our board has a few credit cards. This is kind of a new process for us. We implemented the credit card approximately 18 months ago. But every quarter, Robbie sends to the administrative chairperson a detailed credit card report with all the credit cards, what they were used for, what was the purpose, who used it, when they used it, a very detailed report. So that is what we're also going to talk as a group every quarter. Go ahead, Robbie.
Well, and just to add to that, we have two basic accounts for the credit cards. One is for expenses here at the board office, and the other one is related to the Lotus Recovery House and helps us to cover the day-to-day operating costs for the house when we need to purchase something. So our last quarter to review was covering April 1st through June 30th. And like Mircea said, Tanya sent all the supporting documentation and information to Dean as the admin chair for review. If anybody else wants to see that documentation, we'll certainly make it available. The last quarter activities were mostly regarding expenses for supplies due to COVID-19. And getting supplies such as cleaning and PPE for the treatment providers and for our office and for the Lotus Recovery House. Really, the only other thing to acknowledges we do have a system set up to process the payments very quickly to avoid any late fees, and that's been successful for us. We did, however, incur a late fee this time as one of the vendors we used to purchase the COVID-related supplies charged us taxes when we're to be considered tax exempt. So Tanya believed those taxes were going to be reversed on the credit card and made the payment without the taxes. The taxes, however, were not reversed like they were supposed to be, and so she's working to get those late fee charges taken care of by the other agency or the credit card agency. I don't know if Dean, you wanted to highlight or say anything, but there were really no other items to highlight. This won't require any board action. It's more about being in compliance with the credit card usage policy and keeping the board informed.
I don't have anything further with that, Robin.
Thank you, Robin. I realized on the agenda I did put a star next to it, which it doesn't belong there. Robin is right. We usually just provide you guys a summary and a report to the administrative chairperson, but we don't require a motion for this. Okay, the last 4 items are just updates. No motions are being required here. And then we can open up to all of you guys, or if you guys have any questions. The first update I want to let you know, it's about the Fostoria ProMedica Hospital. Again, I did mention this into my letter to you guys, in one of my letters. Violence Counseling Recovery Services will terminate providing crisis services at this location October 31st of 2020. Okay, we had an in-person meeting with Violence, the hospital, Hancock County Board, us, the mayor of Fostoria, and the chief of police. Since then, we also had, I believe, at least 3, if not 4, WebEx meeting with the CEO and COO of ProMedica, as well as Hancock County and Wood County Board, and a lot of discussions with Violence. I want everybody to know that the city of Fostoria is located in 3 different counties, which is Seneca, Hancock, and Wood. Violence has historically provided services in that community. The hospital, however, is physically located in Hancock County. So in reality, Violence was going out of their jurisdiction to provide crisis services at the location out of our board district. Violence provides services in 6 different counties, and this is the only location where they were going outside of the county lines to provide a service. I don't know if you have questions for me. I can give you guys more details. Is really, I think there are 2 main reasons why Violence decided to cease services there. One is the lack of crisis therapists and the big shortage they are facing, and they wanted to make sure that facilities within the 6 county lines are covered well. And the second thing is just the reality that there has been some not very good relationships between, I would say, Violence and the hospital there, as well as Violence and the city leaders of Fostoria. And I will just stop my comments there unless you guys have questions, and if you have questions, I will answer. One thing that's really important, and this will kind of go hand in hand with our strategic plan a little bit, the reality is our strategic plan, that really our biggest gap is crisis services. And a lot of what I want us to do with the strategic plan is really learn best practices, not just in Ohio, but across the nation. And actually this subject with Fostoria brought me to do a lot of my own education and investigation and survey to all 88 counties across the state. And let me just say this, again, this is a very good education session, I think. most of the counties in a state, or I should say most of the boards in a state, they pay an agency to go inside a local emergency room to provide a crisis assessment. Okay? They have a contract to go in. We have a contract with Farlands 24/7, 365 days a year. If somebody's in a crisis and Farlands is called, they will go to all the emergency rooms in the 3 counties we serve, as well as to the 3 local jails, as well as to the local juvenile detention centers. Okay? When Farlands goes there and sees the client, if the client has Medicaid or private insurance, Farlands will provide a service and bill Medicaid or private insurance. If the client doesn't have Medicaid or is not covered through private insurance or has private insurance that's very poor or weak, then they put in what's called a sliding fee schedule. We give them a sliding fee, and then we utilize board funds if they are residents of Seneca, Sandusky, and Wyandotte. Okay? I would say that 80% of the boards in the state do that. Now, there's also, I would say, 15% of the boards, including Hancock, that Hancock is not allowing or paying their provider to go into the emergency room. Hancock's board stance is if it's the emergency room responsibility to take care of mentally ill clients. I'm not going to send my agency there to provide assessment, and 2, if the client is indigent, I will not cover the service because it's still the hospital responsibility. This is just a summary. Okay, so there are a few counties that do that, and I do think that that's a difference between them. However, in the entire Northwest Ohio, there are 2 counties that do that. That's Lucas and Hancock. But I do think it's a big difference between Lucas County and Hancock County, because Lucas County has a lot of hospitals that has their own psychiatric inpatient units. Now, Blanchard Valley in Finley does have, I believe, 4 or 6 inpatient psychiatric beds. Now, if you look at our community, which are the Seneca, Sandusky, and Wyandotte, Fremont, ProMedica has no inpatient beds. Bellevue has no inpatient beds. Mercy Tiffin has no inpatient beds. Wyandotte Memorial has no inpatient beds. So I really think if we'll take Hancock County approach, we really chop the legs of our hospitals in our communities. Now, another important thing to know, there are a few hospitals, I should say, in Ohio, they have decided on their own to provide their own crisis assessments. In our board district, the one that started that is Stephen Mercy. So the Mercy system in Ohio started to provide their own assessments to these clients. They did open approximately 2 years ago and renovated a larger psychiatric unit in Lucas County, and they do have access to psychiatric beds, and that's probably one of the reasons. And I'm sure there are other reasons why. We continue to have a great relationship with Stephen Mercy. I should let everybody know they have a newer CEO that I had the pleasure to talk to last week, and he used to work at UTMC previously. We have a great relationship with the Mercy ER and their staff. So, but they do conduct their own assessments. Now, one other item I do want to make sure everybody understands is if somebody is seen in an emergency room and if that person is subject to hospitalization at the state hospital, that any hospital in Ohio will have to call our designated agency to go in and do the pre-screening. So even if Stephen Mercy decides I'm going to do my own assessments, if somebody that they come across to is subject to state hospitalization, they will still call Farlands, and Farlands will still go in, and Farlands will work with NOPH for treatment and care of this individual. Okay? So that's, again, a very, very short summary of these services, but this has and is related a little bit with what's happening in Fostoria. And Fostoria has not yet decided how they are going to conduct crisis assessments after October 31st. I believe that they might try to do that through their own system. Hancock County will not send their agency into the ER unless the client is subject to state hospitalization. Any questions?
Mayor Chair, I have a question. So Seneca County residents that go to Fostoria Hospital in need of services, I guess number one, how will those be handled? And if ProMedica decides they're going to, whatever course they take to handle that, are we bound by their decision to support that financially?
Very good question. Let me answer one at a time. The first question is, once Fallens pulls out, Seneca County residents that are in a crisis at the Fostoria Hospital will be the responsibility of the hospital and the Hancock County Board.
Oh, Hancock.
Correct, because the hospital, the location,
Okay.
physically located in Hancock. And one
Okay.
example I can give you is if somebody who's a Hancock County resident goes to Fremont ProMedica in a crisis, Fallens will go and do the assessment. Fallens will go at all of our locations regardless of the county of that individual, regardless of the county. So Fallens has committed to us to go regardless if the client is from Romania and is just traveling. If they are in a crisis, Fallens will go. We always do the crisis and take care of the crisis assessment first. Then the second piece will figure out the payment piece. We had instances where we had immigrants or people from other counties or people from out of state in a crisis situation. Fallens cannot tell us no if the facility is located within our board district. So therefore, we believe the same shall be for a facility in a different county, which it is.
Okay.
It is seen the same approximately 80% of the counties, but not all.
Mircha, I got a question on the whole thing. We represent Fostoria as a whole, even though those people are in Seneca, Seneca, Hancock, or Wood. So with those three in the city, are we restricting ourselves? Well, I'm hearing two things. One is that we're a 3-county unit, which is, the 3 counties we have. We do not represent Wood and Hancock, but we do represent the city of Fostoria. So there's 2 different things here. In the hospital saying that they don't recognize us because the person lives across County Line Street. Is that what I'm hearing?
No. The hospital will recognize our clients and they'll take care. They'll provide the same care regardless where the client is from. The hospital didn't want this change. This change is coming and is led by Fallens, not by the hospital. So the hospital is not the one to decide, I don't want Fallens here anymore. It's Fallens who decided, I don't want to go there anymore. Now I do understand that Seneca County, I believe in many things, kind of covers the entire city of Fostoria, such as I believe the health department. However, when it comes to mental health and addiction boards, we are kind of bound by county lines and not by the cities. And one other example I can give you is Bellevue, which is a 4-county city. We're going to cover our two counties when it comes to Bellevue, but then somebody has responsibility for the other portions of Bellevue. I do want everybody to know that Fallens will continue to have an outpatient office in Fostoria, and they are the only, I believe, certified mental health agency in Fostoria. So they will continue to see Fostoria clients in their outpatient office. They will just not go to the hospital ER to provide the crisis assessments. And then Celinda, you asked me about finances, correct? Can you repeat that question about finances?
Well, I guess I'm just curious. We're not really making the decision how that's being handled, correct? I mean, the hospital evidently is going to make the decision. So are we bound by their decision to support that financially?
No, we are not bound to support it financially, no. And we are not supporting Tifo Mercy financially.
Okay.
and we are not bound to support Fostoria ProMedica financially. We actually don't have a contract with any local hospital or emergency room.
Okay.
And it's kind of similar to the county jails. If somebody's in a crisis, a Seneca County jail, even if that individual is a detained immigrant, Fallens will go and respond if asked by the sheriff or the jail staff. But I want to make sure this wasn't our board decision. This really wasn't Hancock's board decision. This was really a Fallens-driven decision that made all of us look into the Ohio Revised Code and Ohio Administrative Code and having probably close to 10 meetings by now trying to figure out how this will work. But there's no disagreement between us and Hancock County Board. We actually have a great relationship with them. It's just that the way they do some things and the way we do some things are different. Correct. The way they provide their crisis, the way we provide our crisis is different. We have always tried to send Fallens and see the clients face to face and make sure they are there on time, and we invest in money for the wait time, especially when law enforcement are involved, to be reduced as much as we can. Where Hancock County has changed the way they provide crisis services approximately 3 years ago. Really saying is the hospital responsibility to provide services. Anybody walking into the ER, why should they send their agency to assess people in a mental health crisis?
And I just want to add to it that I think it's important to note that Firelands has done this service for over 20 years when they didn't have to do that service. And for whatever reason, 20 plus years ago, the decision was made that Firelands would do it. That was before any of our time, I believe, and we weren't involved with those discussions, but they did do it for 20 plus years when, like I said, they didn't have to.
I do believe that what Robin is correct. What Robin provided for 25 years was unique out of all 88 counties. I didn't find any agency outside of the board district to provide crisis services. Now, I wish it wouldn't, I guess, turn out the way it is. That's a little, I guess, division right now at the moment between ProMedica and Fallens. But I hope they're gonna work through their differences. I do have a good relationship, and I respect both organizations. I'm in contact with both of them more than once a week, and I hope they. We want to make sure our clients are being served. So I did mention to Tom, who's the Fostoria ProMedica COO, great relationship with Tom, and I did mention our role is to do everything we can to make sure there's quality services for Seneca County residents in a crisis. So we have regular calls to make sure that happens. If we are planning some sort of written or contractual agreement, I'll obviously have to bring it back to you guys. But I know my goal is to assist him the best I can to make sure there are quality services for those individuals. Any other questions? All right, the next one is I also put this in a letter, and I'll be short here just because of the subject matter, but there has been a negotiation team created between the Board Association and the Providers Association. There have been 6 members selected from the Board Association and 6 members selected from the Providers Association, so a total of 12 members to create a negotiation team due to working relationships. Let's just put it that way. We are in the middle of the 12 of us agreeing on a facilitator for those. We are not there yet. But as boards, I think we do want to make sure we represent the boards well, and we try to work out to some of the differences that are happening in some parts of the state between providers and boards. If you have questions, ask me. I am. It's kind of time consuming, but I guess I'm glad I was asked to be part of this negotiation team, and it gives me more knowledge and education, and it keeps me kind of up to date what's happening at the state level and in Columbus. And to be honest, through all the groups that I was involved with the association, I am the chairperson of the fiscal committee. I'm the chairperson of their levy committee, chairperson of their another committee with the state fiscal team. I just learn a lot, I guess, and I can bring those things that I learned back to our board. For example, again, we just started. There are 8 or 9 boards in Ohio that are conducting or running levies in November, and they really wanted me to chair the committee, even if we don't have a levy on a ballot. And I was able to do 2 different presentations to them about things that we did here. So I will try my best to stay involved as much as I can. I want to make sure I don't run myself too short on some of the local stuff, but this gives me an opportunity to get the feel on what are the hot topics at the state level. And I think every board should have somebody in some committees to know what's happening at the state level. Any questions? All right, the last 2 items are board members only access. I believe Rose sent you guys an email also in the last 2 weeks with username and passcode, and if you go on our website, you can log in, and there, due to COVID and due to trying to be up with 2020, we have created our board member manual in an electronic format. We used to give our board members and new board members binders. Instead of giving you guys binders now, you have it in an electronic format on our website. You can access it anytime you want. I believe we also put information about Ohio Ethics, Ohio Sunshine Law, Ohio Revised Code 340. So things that pertain directly to you, we will just put them onto the board members only access stuff. You guys only will have access to those. Every one of you guys, you have your username and password. I am planning that maybe starting September, there are a few sections of that board member manual that I think we should discuss for 5 minutes before each meeting, especially that now we have a few new board members coming in, as well as I truly believe it's very good reminder for all of us about some of our duties and responsibilities. I will also email all of you guys prior to the next board meeting, if you guys didn't receive it yet. I email all of you guys a form where you guys have every board member name, home address, cell phone, home phone, email, and so on. You guys have asked for it around 2 years ago to have it just in case you want to get hold of one of your peers or want to send a Christmas card or you want to send whatever, a happy birthday card. You will have that information. We will not share that with the public. There will be just something that the 14 of you guys will receive. And any questions about any of these 2 items? If you can access it, please contact Rose in our office. I think she set all of you guys up. And the last thing on the agenda, I do give you guys an update just to let you guys know. You guys conduct the annual evaluation to me as the executive director, and then I conduct the annual evaluation to all the board employees. I did conducted one for Robin beginning of August. So we conducted her annual evaluation. If you have questions about it or if you want to see it, please contact me and I can share that with you. That's in the employee file. We will not email that to you or put it on a website, but you can have access to it if you want to see it or if you have any questions. Please let me know. As a reminder, we passed a fiscal resolution, I believe in February. All of our salaries and benefits and everything, it has been frozen for 12 months. So no board employee, regardless of their performance, will see any increase until we review that resolution again February of 2021. The reason I said that is because Robin deserved an increase, but I told her I'll buy her a Snicker bar. We can open up to any questions you guys have, and I know that the discussion about Fostoria was maybe a little complex. If you want to go back and ask more questions, you can about that. I will probably keep that on the agenda for now, for the next meeting, in case things progress. But go ahead, if you have any questions, please let me know.
Mayor Chance, I have a question. I noticed that on the 26th of this month from 6 to 7:30, there's going to be a recovery from addiction put on by Firelands. Is that an actual in-person thing, or are they going to do it on the WebEx type? You're laughing.
Well,
right? Who
God knows
knows?
why I'm laughing, but Firelands has decided to host it in person.
Oh, okay.
So it's an in-person training. Now, that's one very good point you brought. We are planning again in August and every month from there on, to give you guys a list of upcoming trainings to make sure that you guys are meeting your responsibilities as a board member. But we are planning a list for now to give you all virtual trainings that you guys can take and that are approved. So yes,
okay.
that is an in-person training.
Okay. All right, thanks.
Yep.
Well, Robin, I just want to say thanks for all your hard work. I too wish that we could give increases this year, but well, I'm sure that we'll get back to that in good time. And Charity, I wanted to say welcome. And to everybody else, I really do miss seeing you guys in person, but hopefully we can get together again soon.
Thanks, Linda. And I just want everyone to know I'm a grateful employee. I understand the situation and just glad to be here.
We need to work for the city of Fremont to get better pay. Okay, if you guys if you have any questions from now until the board meeting, obviously, please contact us. Program committee, they have a pretty full agenda similar to ours. We will put the recording. We'll email you guys the recording or put the recording on a website. They will have different agenda items. So if you want to review their meeting so you are not surprised during the board meeting, that's fine. But if you have questions during the board meeting, you can also interrupt us. Anything else?
I do, Mayor Chance D again. How's that?
I'll ask you to please repeat the question. We didn't catch that.
How is Alex and her family? How are they doing since her father passed from the COVID?
I think she's doing better. We are in touch with Alex. We are still in touch with Alex every week. I'll probably have her give you guys updates if she wishes during the board meeting.
Okay.
But she's doing better. I don't want to go into too details into her personal stuff, but
right.
I will ask her to probably give you guys an update.
Okay. Well, just think about her.
Charity, any questions?
No, I'm good.
I know this committee meeting was probably a little bit too much finances than what the program is, but
That's okay.
all right.
That's good to know. Okay.
Hey, Karen, were you able to hear us well on the phone? You are muted. Robin, you want to try to unmute her? Karen?
I heard it all. It was very good.
Okay. All right. Well, we will adjourn then at 5. I have 5:42. And again, thank you everybody. With everybody who joined, thank you again, and I will see you guys next Thursday, August 27 at 4:30 p.m. Thank you.